Hi, my name is Dr. Jesse Butler. I'm a naturopathic physician. My clinic is Northwest Natural Medicine. I'm here today to give you some information about the type of medicine that I use as it relates to the type of patients that I treat, and a general overview of how I work with my patients to help them address the underlying causes of what is ailing them as it relates to their health. That principle of causation, I truly believe, is in the end the most important thing that a physician should be addressing with their patients. Too often in healthcare, our focus is on addressing signs and symptoms, which are just that. A sign and symptom is a feedback that the body will give to an individual to let them know that there's a concern going on. Way too often in healthcare, our focus of treatment is on signs and symptoms. It is not on an understanding of why they are happening. And of course, if you're dealing with an acute situation, it is prudent at times to treat a sign or a symptom. And that's not what I'm talking about. I'm talking about individuals who are suffering from an ongoing standpoint with health conditions ranging from hypertension to depression to multiple sclerosis to cancer and everywhere in between. These symptomatic responses, these disease responses that we are suffering for, and the lack of understanding of why they are happening. Disease happens in our bodies for two primary reasons. The first is a state of toxicity or burden that occurs within an individual's body, within their physiology, and it begins to overwhelm uh, the individual's capability of eliminating that toxicity. Toxicity comes in physical forms. Toxicity also comes in emotional forms. Stress is another significant contributing factor to the conditions that we deal with as individuals as it pertains to our health. And in my experience clinically, those really start to become the two primary drivers of illness and disease as it relates to my patients, the concepts of stress and toxicity. And really, in the end, your goal as a physician is to begin helping your patient understand, why they are dealing with the signs and symptoms that they're dealing with, and begin helping to educate them on the causes of them as it relates to stress and toxicity, and create a plan and a very clear guidance of what they need to do to start taking control of their health so that they can change and not continue to keep doing the same thing and expect different results. If I understand that correct, that means the definition of insanity. And I believe that is we're too often short-sighted in our healthcare model with an assumption that if we just treat signs and symptoms that people will get better. And in my experience, they don't get better. They continue to keep moving down the path that they are on without any tremendous ability to change what is going on. And that really becomes the focus of what I do at my practice is I work with the individual to educate them, support them, and hold them accountable in regards to a treatment plan that is designed around nutrition, that is designed around support of the detoxification pathways, that is designed around giving them tools and principles to break free from fear and the undue stress response that we suffer from, which gives the body an ability to heal. And if we do that, positive things happen, healing can take place, and it empowers my patients to understand what they have to continue to do to stay healthy.